welcome back to Minnesota Live. So happy to have you here with us this morning. I'm Elizabeth Reese. This is Paul Folger. We are, of course, filling in for Chris and Megan today, who I'm sure have their feet kicked up somewhere, you know, haven't even brushed their teeth.
I hope so.
They're just living their best life.
Second cup of coffee.
Yes, but we do have a serious topic to talk about this morning. This is really a staggering fact. Here in Minnesota, every day, on average, 200 calls are made, and those calls are made to report known or suspected child abuse.
You really hate to hear that number. 200 is huge.
One is too many, right?
Even one is way too many. April is Child Abuse Prevention Month, so there is an event coming up next week. We want to tell you all about it. Melissa DeBelslin is here, and the Executive Director for Safe Passage for Children of Minnesota. Melissa, we are so glad you're here. Thank you for taking the time today.
Thank you, Elizabeth and Paul, for having me. I appreciate it. This is a really important topic. It's a tough topic to talk about, but it's important.
Do you find that sometimes it's hard to even talk about? You know, as a mother, it's like I can't watch shows that depict child abuse. If I read a book, it's like I have to just stop. And so I wonder if that's a barrier for action being taken, because there's people who are just like, I can't handle this.
Absolutely. I mean, I think none of us want to think about children who are being abused, but the reality is, I think what people would be surprised to know is that this is happening every day in communities across Minnesota. So we know there were at least 5,000 kids who were victimized, who suffered injuries last year, and over 20 who died. And this is consistent year after year. And, you know, that's on par with the number of kids who are dying from cancer in Minnesota every year. So we're looking at this as an organization and saying, something needs to change. You know, we need to be taking action. We all are responsible for making sure that kids are safe.
So you did this by starting the Safe Passage for Children of Minnesota. Tell us a little bit about what it is and how it works.
Yeah, so Safe Passage for Minnesota is a nonprofit organization. It's a grassroots advocacy group. And really what we're focused on is making sure that we're advocating for kids who are being abused or who are at risk of being abused. Child maltreatment could involve sexual abuse, it could involve physical abuse, emotional abuse, it could involve neglect. We're seeing a lot more cases of neglect these days, especially fentanyl-related overdoses, and the drug pandemic has really had an impact on parents' ability to take care of their children.
So that's probably the most acute reason for an uptick right now?
Yes, we're seeing that. We're doing a lot of research and studying kind of the child fatalities, looking at information we're getting from the state and making sure that, you know, we're asking for more transparency as well.
And you know about this because you were director of the executive director of the Minnesota chapter of American Academy of Pediatrics. So you have a lot of experience in all of this, and you saw this need popping up, and you said we've got to do something about it. And you've got quite a list of volunteers and people that are helping out now.
Yeah, you know, Safe Passage was started back in 2009. I'm relatively new to the organization. However, we're working with a variety of frontline professionals who are volunteering with us. So law enforcement, child abuse pediatricians, county social workers, you know, we're working with a variety of people who are seeing the impact of abuse on kids every day. And our job is to look at the laws that are currently in place and say, you know, this needs to be changed. We're not okay with this. We need to make sure that we're prioritizing the safety of children above other competing interests, above other goals that the state or other organizations might have.
Yeah, because everything is a priority list, and you've got to fight for what you think is the top priority, and I think all of us can collectively agree that this is a big issue. When it comes to signs of abuse, I'm interested in this because I think a lot of us have that like stereotypical, you see bruises or burns or something, but what are some of the other things that you might want to look for when you're maybe in your community, when you've got kids over or grandkids over and their friends are over or neighborhood?
Yeah, that's a great question. So in babies, for example, any bruising that you might see in a baby and an infant who's not mobile, that's a red flag.
Yeah.
In older children, you would want to look for if there's bruising on their head, on their neck, on their trunk. That could be suspect also, and may not be normal, and so, you know, may prompt some additional questions, or especially if you see patterned bruising. So you might even see a handprint, or you might see what look like belt marks on an arm. All of those might be red flags.
What about like hygiene? Because you were talking about that neglect issue. I mean, that's not as necessarily as like an individual injury, but it's
Exactly.
abuse and trauma over time.
Exactly, and that's such a tricky, thing to know about, because, there's a difference between poverty and then,
For sure.
neglect,
Right.
purposeful neglect by a parent. And so, I think that the most important thing to do is, if you're seeing those signs, ask questions. You can always call your county social services agency and, report your concerns to them, but then they can advise you on whether to file an official report or not, based on some of the signs that you're seeing. And this is really important for like teachers and other people who are coming into contact with children on a
Maybe
regular
coaches,
basis.
yeah.
Yeah, exactly.
And I think it's a tricky spot, because if you see something and you suspect it, you think, well, do I make this call? But maybe it's better to err on the side of caution.
It is better to err on the side of caution. You can always get some advice from your local child welfare agency, your county, and ask them, this is what I'm seeing. Do you, think that it's worth putting in a report or not? And they're really in the best place to advise on whether a report like that would be screened in or whether it would be screened out. And ultimately, it's up to you. Ultimately, it's up to you whether you want to file the report or not. But yes, we always encourage people to err on the side of caution. If you have a gut feeling that something is off, then call and make a report. Or if you know that a child is in immediate danger, you always can call 911 or your local law enforcement agency.
How can people help you before we go? If they say, okay, I want to get involved, I want to be part of a bigger picture solution.
Yeah, so we are having an event on Tuesday, April 1st. It's a vigil on the steps of the state capitol. It's really a way for us to honor the victims of child abuse and all of the children who have died, all of the children who have suffered injuries, and an opportunity for us to invite legislators to come alongside us and get this message out there, that it's so important that we all have this responsibility to take care of the kids in our community.
That's so great. I think because really the only antidote to that feeling of, paralyzing overwhelm is empowerment and taking some
Absolutely.
action. That's really helpful.
Absolutely.
Thanks for all you do.
Thank you so much.
Important topic.
That is great. Let's give you one more look at where this is, because this is a perfect way to sort of get involved in this if you want to take those first steps. This is next Tuesday's vigil with Safe Passage on the steps of the Capitol. And you can see it right there, April 1st, 8 to 8:30 p.m. So it's going to be light outside.
Yeah.
Daylight saving time, so go check it out. We'll post more on MinnesotaLive.com.